The topic is the Duke University Lifestyle Medicine Clinic. And of course, we have the director of the Duke University Lifestyle Medicine Clinic, Dr. EWestman. And of course, Dr. Westman, let's pick up where we left off during the end of the first segment by having you to, again, join us in reference to some of the things that you were talking about.
Well, the number 1 and 2 causes of death in the United States are cigarette smoking and weight, obesity. So I just happen to have the research at Duke that addresses smoking and obesity. So we decided to build a clinic based on treating the smoking and obesity at Duke. And we call it the Lifestyle Medicine Clinic because there's a national organization called Lifestyle Medicine. There's a textbook. You can go get it. It's about this thick. But you know, really all we're doing is helping people to change their lifestyle. We use medicines, but we're actually finding that we don't need medicines so much if people really change their lifestyle. Let me give you an example. We had a patient just recently who was on 200 units of insulin for type 2 diabetes. And she's overweight. In fact, she would meet the criteria for obese. And just by changing what was going in her mouth, we're able to get her off half of the insulin immediately. Immediately, the first day. In fact, you have to be careful because if you don't reduce the insulin, she might go low on the insulin. So should someone think they want to do this on their own, they need to do it if they're taking insulin with someone who knows about
some controlled conditions.
That's right, medical supervision. But even then, doctors who know about this. So that's where the American Society of Bariatric Physicians can help, because I help train people at their meetings in different approaches, and this is one of them. You know, we also use medicines, appetite suppressants, things like that. But the power of lifestyle. So my dream is to influence medical care such that doctors talk about the food, talk about the food that goes in the mouth. And this is nothing new. Hippocrates said that food was medicine. Now, they didn't have pills then, but if doctors could just ask not only the food, but the drinks, what goes in the mouth, this is just so powerful. The changes that I've seen, I wouldn't have believed them before I went through the studies.
But you find that it's difficult for physicians when they treat their patients to actually inquire as to, an individual comes in to be treated, overweight and whatever. You mean physicians rarely think in terms of the diet that individual has? Is that what?
Of course, everyone's different, and those doctors who are really interested in prevention have always done this. But there are a lot of doctors who will go to medication first. And they're even kind of in the point where I don't know that my patient will be able to do any kind of diet change. You know, in the past, they never have, and now in the future, I don't think they will. So they don't even give it a chance. And that's just not right. I mean, a patient needs to know that by using maximal lifestyle change, and really this is just diet, up front you don't need a whole lot of exercise, that big changes can occur in diabetes. Let me give you an example of what we use in our clinic. This is a 12-ounce Coke or soda. It could be Pepsi, it could be Dr. Pepper. And we use this because I asked the patients, how many packets of sugar do you think are in that 12-ounce Coke? You know, would you venture a guess?
5.
5. Well, there's 1, 2, 3, 4. 5 was a good guess. I think I would have said 2. 6, 7, 8, 9, 10.
How could 5 be a good guess if there's 10, actually 10 in there?
Some people don't think there's sugar in there at all.
Okay,
so
that's,
for a diabetic, this goes in the mouth and raises the blood sugar immediately. So we had one patient in our clinic who came off 80 units of insulin in 3 days because the insulin was treating, it wasn't Coke, it was sweet tea, which is probably an issue down here as well. But the sweet tea also raises the blood sugar. So in our clinic, we take time to explain this. And most doctors just don't have the knowledge. They'll send people to diabetic training. The reason that a doctor needs to do this is that it's as important as medicine. So what do you think about that? The dream that one day every doctor will go over the medicines and also the food and the drink. You think that's achievable?
Well, to be honest, Doctor, I thought that that was the way that would happen. That would be natural if you've got an individual who's coming in who is obese, and you wonder how he got obese, you know, and that would certainly have to do with lifestyle and with diet or whatever, and et cetera. But if you have to convince physicians to do that, I can certainly see the importance of doing so, because it's much more important to do it that way than to spend all of the money on some of these drugs and medicine and et cetera. And so, yes, I would.
That's very expensive today. You know, we have people on 4 or 5 different diabetes medicines, and just by changing, in some cases, the drinks, we're able to reduce or eliminate the medicine. So it's really exciting as a doctor.
It is.
It's unfortunate people get in this predicament, but with this knowledge, I go to work every day just really happy, and I go home happier. So,
but you find that your fellow physicians are having a difficult problem accepting that as a point of view.
Well, the doctors are listening through the patients. So, you know, in my own area, there's been a change, but it's not common knowledge. And you know, most cardiologists think about the drugs first. Most endocrinologists think about insulin and the diabetes medicines first, without full, you know. Also, what we're doing is we're addressing carbohydrate intake. And I'll get into that a little bit the next time.
Very good. And of course, this is what we wanted you to give us, Doctor, about this lifestyle medicine clinic at Duke University, because I think it's very, very important. And I think we feel encouraged by the fact that we do believe that a large number of physicians are by now coming around to a point of view in reference to the importance of diet. All you have to do is to listen to many of the commercial radio stations, television stations, when people talk about fruit, vegetables, and et cetera, and to understand that there is a close connection. And I would assume that a doctor who is not pointing that out to an obese individual really is not giving that individual, I believe, the best service. Now, I don't want to get on a soapbox in reference to this, because these are some of the things that you have to deal with, but I think that what you're doing now is certainly essential if what is happening as you are explaining it.
Thank you.
Yeah, well, I think that it's very important. And of course, we'll be back with our audience following this very, very short commercial break. Westman from Duke